Well, thank you. I do appreciate the update, and I see it is now past 7:30, so we can officially call the meeting to order. It looks like we're missing a full member, Joanne. Have you heard any update on Joanne, Cheryl?
I did not.
Okay. Of our associates, please remind me whose turn it is to be the alternate. I think it's Rika's turn, but I might be mistaken. Does anyone remember who did it last?
Yeah, I think that's the case.
Okay. Well, we'll see. I'll read the script, and if Joanne hasn't logged in, then Rika, would you please jump in for Joanne and until she comes, joins the meeting?
Yes, I'll do that.
Thank you. So just a brief announcement. It's a script the town likes read. This meeting is being conducted remotely under the provisions of Governor Baker's order due to the global pandemic, which unfortunately is continuing, the pandemic that is. So the meeting does allow for public participation, public access to understand or observe the meeting, but it doesn't guarantee the right to speak at the meeting. However, it is board practice to typically allow public comment on any motions prior to the board vote. And so this is a meeting of the Board of Health, and let's see if there's anything else. If you do wish to speak, we ask that you please state your name and your location, because we'd like to make sure that we've got real people that are commenting on issues that are before us. And other than that, I think we're good to go. So the first item on the agenda is an operational update on the global pandemic, as mentioned. And it appears that we've got some new developments. So I think we've got lots to talk about. Cheryl, if you'd please bring us up to speed.
Sure. Good evening, everybody. So I'll start with the older news. So last meeting we talked about hockey being a trend, and then we were seeing a trend in Acton. And I had sent you all a hockey order that was issued by the state, essentially shutting down ice skating rinks until November 7th. And I think that this was done to hopefully contain the clusters that we were seeing. In addition, we had report of a positive case of a user of our skate park. So we sent out a news blast on Friday and shut the park down for 14 days, which will be November 7th would be the last day for that. We have been doing, trying to figure out who was there. We asked residents to call us to report if they were there. And I did get 8 phone calls over the weekend where people self-reported to me that they were there, but it seemed like the people that I spoke with were all social distancing and had face coverings on. So that was good news. We've had a few retail/businesses that have had some positive employees. One in particular, I sent a written warning to, which I included in your extra information packet. And that one, I've asked them, they conducted a deep clean of the entire facility. And they also outlined a plan to our department for approval for, measures that they can take to prevent this, which includes additional cleanings, more monitoring the employees when they walk in the door rather than asking them to self-report. So they took this initiative and developed a plan which looks, like it's definitely going to be beneficial to this establishment. But I did want to bring that up. We've had, some businesses also report that they've had, positive employees as well. So, contact tracing, and, Heather can speak to this a little bit, it's been pretty significant these past couple of weeks. It's been a lot. Which brings us to today, where the governor issued 3 new orders. One's a face covering order, one is early closure of businesses, and the other is a gathering order. So with the face covering now, these are all those orders, new orders are effective on Friday, November 6th. So face coverings are now required even when you can't socially distance. There's provisions in that
Hey, Cheryl,
order. Yes.
I think you got it backwards. I think they're required even when you can socially distance.
Oh, yeah, you're correct. Sorry, I completely misspoke. Yes, they're absolutely required even when you can socially distance. So, so that's new. Basically, in a sense, it's requiring face coverings when you leave your house, pretty much. You know, in a nutshell, you know, it's going to be difficult, I think, for us to enforce. You know, there are provisions for fines in that order. So it's something I wanted to discuss with the board, you know, what kind of procedures that you guys would be looking for. We need, you know, in the next few days, we're going to have to spend some time getting up signs in our public places. I mean, there are signs there now, but I think they just need to be worded a little differently, because right now, you know, people feel that they can socially distance when they use the rail trail. And given this new order now that it doesn't matter whether you can socially distance or not, they're still going to be required. So we've got to get some rewording done of those signs and get them posted at our facilities. The other part is they basically are telling restaurants and a lot of other businesses that they now have to close by 9:30 to the public. So they can still remain open for takeout. And then, you know, and those businesses that are impacted are like restaurants, liquor stores, both indoor and outdoor events, theaters, movie theaters, performance venue, youth and adult sports, golf, boating. You know, some of these on the list are definitely gyms, museums. So some of them on the list are obviously closed when it gets dark for the most part. So it's not going to be too impactful, I don't think, for some of the sports, unless there's like an indoor facility that is operating sports and now going to have to close at 9:30. In addition to that, there is private resident gathering orders. So they're saying the order says that you have to maintain 6 feet of social distancing in your home, except for people that actually live in your home. And private residents are now limited to 10 people for the gathering for indoors and 25 people for outdoors. All public gatherings will have to end by 9:30 p.m. Indoor, they can do 25 people. And outdoor in a lower risk community can still be 100, but all others have to be 50. One of the new orders does require that anybody that's having a gathering has to report that they're having that gathering at least 1 week in advance to us. So that'll be helpful. There is also a stay-at-home advisory, which is from 10 p.m. to 5 a.m. And that is basically advising everyone to stay at home unless they need to go out for critical errands, which could include groceries, and even taking a walk, which to me, I thought for them to put that out there was kind of, you know, I don't really think you need to take a walk at 10 o'clock at night, but whatever, I guess maybe some people only have time then. So that's pretty much in a nutshell what went down today. You know, it just came out like this afternoon, so I really haven't had a lot of time to digest. But yeah, you know, I'd love to have a chat with the board and see what you all think about it.
Okay, well, thank you, Cheryl. That's interesting developments. I think some questions immediately come to mind. The businesses that have to close, I guess, would not include things like the 24-hour CVS because they provide essential goods or something like that, I would assume. And
Yeah, you're correct. You're correct. Pharmacies, gas stations, retail stores, and supermarkets can be can actually stay open after 8:30.
okay, and then the stay-at-home advisory of takeout foods available after the 9:30 close of a restaurant. I guess that's one of the reasons that you can go out then, is to go get your takeout food.
Correct, correct.
Okay. Interesting. And then how about like youth, softball or football, or do they have to wear masks while they're playing?
Yeah, so the way I read the order, it basically says that, like I said, you walk out your door, you have a mask on. It doesn't matter what you're doing. So the order really didn't get into the sports. But I am reading it that they're going to have to put face coverings on. I mean,
Okay.
they still have the medical exemption for people that can't wear one due to a medical exemption, and they, again, still do not have to report, they don't have to tell anybody that they have a medical reason that they're wearing it, except for an employer. So an employer can make provisions now for people that need, that can't wear them for medical. So it's a lot.
Okay.
It's a
Yeah, and I suspect just like the last go around, there's going to be further cycles of interpretation or clarification forthcoming.
I agree. And your sports one will probably be one of the first ones that we hear about, I would think. I mean, that's what happened after the last one. And I believe this is the governor's attempt to try to keep facilities open because, as you all know, we are heading into our, I guess you could call it a third surge. So, and it's been crazy couple weeks actually.
So could I ask, did the governor's order have an expiration date, or it's just good until canceled?
I don't think so. Printed them right here, so. Oh yeah, no, they do. Wow. This one for closure is only in effect till, oh no, it's effective November 6th. No, there's no expiration date.
Okay.
It says the order shall remain in effect until rescinded or until the state emergency is ended, whichever occurs first.
Okay. Very good. Well, thank you, Cheryl. Obviously this is, deja vu all over again, as they say, as Yogi Berra said. Could I ask members of the board any questions or comments? No one? You're all, no, Mr.
Yeah.
Conaby.
Nope.
Yeah, a few questions. Cheryl, I mean, you're going to obviously have to post some areas and hopefully you can get some help from other folks in the department. You said, you mentioned the rail trail, NARA, the skate park when it comes back, and a bunch of the other recreational facilities and the athletic facilities. Another question is, looking at the order, it says that the department has to be notified a week in advance and it's effective on Friday. So you're going to have a lot of work coming up. But what do you do about all of the religious facilities on Saturday and Sunday? Because those would be over 25 people, but you couldn't get the permit a week in advance. So I guess you probably want to reach out to those folks.
There was definitely a exemption for religious activities for the gathering order.
Good.
So they definitely exempted them. So that, honestly, I had a meeting today and the one of the clergy was in the meeting and she said there's only one worship that's actually open for people to congregate, which I was kind of surprised to hear because, that there is the ability for worship to hold in-person gatherings. So I don't know. I mean, but no, there's definitely, I'm looking at the order right now, Mark, and there's definitely gatherings for religious activities and political exemptions for political expression and religious activities.
Hopefully the latter will be done by the end of the week. But yeah, I just wanted to make sure that you realize those are coming forward. So you got some posting issues, the masks, obviously is going to impact some of the schools. Now, what about, we had some licensed childcare facilities that were doing remote. I don't know how that impacts them. The recreation department, and I believe it was Teamworks.
So they're requiring, the schools and the any of the schooling is requiring face covering. So that shouldn't be any different from them, but I can follow up with them as
I
well.
was thinking of the limit of 25 people.
Oh, the gatherings. Yeah. So it's a 1 to 13 ratio, and I actually think that they're 26 max, so they might have to reduce by 1, but I can reach out to them.
Well, I didn't know if it was also including staff, which would,
Yeah, true,
so that would reduce it even more.
true.
No,
And
I
you
think
bring
there
up
was-
a point. I was supposed to update you about the learning, remote learning, which you asked me to do every week, every time we met, but there's been no additional applications. So still right now, we're Teamworks and Acton Recreation.
yeah, I think there was a statement that the staff don't have to be counted. It's the
I'll look
participants.
into that.
Yeah.
All right, thank you. Mr. Cruz, I know you had also were interested in speaking.
Yeah, I did see one piece of good news that the Thursday report for that lists the communities, Acton is still green. I hope that continues. But I'm not surprised at the actions that were taken by the governor. I know some organizations seem to be very good at following guidelines, but in like the skate park, I think that just needed to be closed because essentially there was no adherence to much of anything. It's almost like the pandemic never happened. So those are my comments that I have.
All right, very good, thank you.
Yeah.
Other, please go ahead, Dr. Bill.
In one of the whereas, that the hospitals are 60% capacity with COVID.
Yeah, 67% capacity, which is very troubling.
Yes.
Okay.
Cheryl, what did you say about enforcement?
Enforcement is going to be it's going to be difficult for us. I'm hoping that people are understanding. The levels are increasing, the transmissions happening more and more, and people will follow this order. But we'll do our best as always to enforce. I honestly don't know how we're going to enforce people's in-home gatherings, short of knocking on people's doors, and saying, do you have less than 10 people? It's going to be difficult, but we'll do our best as we always do.
I think maybe Dr. Jacoby was asking, I think you had made the statement, there's actually no penalty for violations, so, or is there?
No, there's fine provision. So oh, sorry, Dr. Jacoby, I didn't hear you well. The fine provisions, they are up to $300 per violation if you don't wear a face covering. And then one of the others, I think it's the the store's not closing, can be up to $500 per violation. And the gathering, I forgot to write that one down, sorry.
Well, I think one thing that's interesting on the gathering, it's not actually a permit or a license, it's just notification, right? So in other words, you don't have to grant them a permit. They just are supposed to tell you who's there so you can contact trace if you need to.
Correct. So that's $500 fine as well. So I thought, the board, we should have a discussion on, how you want me to proceed. I'm hoping for compliance, but I don't expect full compliance. So, it's the fine provisions are up to those amounts that I suggested. So I'm just wondering if the board has, numbers that they'd be comfortable with us starting at.
Well, who's
or-
responsible
or-
for the fines? I mean, who's responsible for issuing the fines?
It would be us.
Us
Or-
meaning board members or us meaning what?
It's written as
Probably police officers can too, usually.
Yeah, I think it says, let's see, it says Department of Public Health, local boards of health, and their authorized agents, and state and municipal police are authorized to enforce.
Oh,
Yeah.
so to
Do
answer,
do you want to go out with a violation book and start citing people?
Honestly, if we, I hope we don't have to do that. We are inundated just trying to keep up with our jobs. Never mind our regular jobs in addition to enforcing all these COVID. I mean, if that's what the board wishes, then we can discuss that.
I think so. I'll just share my thoughts, and then the board can chime in. To answer your question, Charles, of what we'd like to do, obviously, I think we would like social persuasion to be the key tool. Reminding people that there's a pandemic and they need to play their part to we're all in this together, sort of thing. And that hopefully that will remind them. If you have folks that just simply refuse or are continuous violations, and I don't know, I would suggest we start at something that sends a message but isn't overly punitive, $50 or $100, something along those lines, because it'll probably cost the town more than that to process the violation, truthfully, just as a guess. And if if it let's hope it doesn't continue beyond that. If it does, I guess we can escalate the fines. Other board members, comments? Ms. Becerra, I see you've unmuted.
Yes, yes. Just, spitballing here, but I'm wondering if, the resources for enforcement are limited, maybe not focused, but if they're going to be fines, perhaps fines more against businesses for not complying with the masks or or that stay open later versus individuals. I don't know. I don't know if there's a way to differentiate, but I think
Yeah, I'm
that
very
might be one way to look at it.
Sure. I'm very hopeful that most individuals, when you say, hey, you need to wear a mask, will say, oops, and put on a mask.
Right, exactly.
And in which case, then we've achieved what we wanted to achieve without having to do any paperwork. It's if they go, heck with you, I'm not putting on a mask, you can't make me, that's when we might have to say, well, then here's a ticket for you, Mr. Conaby.
Right.
I think we talked about in the beginning of the pandemic with trying to do, like you said, the social persuasion and education. So if we can suggest that they wear a mask, if they don't have a mask, give them a mask to try to enhance the compliance. But like you said, if you have recalcitrant or repeat offenders, then obviously that is the last resort of going ahead and doing some sort of escalating fines. It shouldn't be trivial, but certainly for first offense, or I don't think you want to go with those type of fines. And it really is an individual matter. So I think that the enforcement should be focused on the areas of the community where it has the most impact. So probably having the municipal police do most of it would be prudent at this time, since you guys are already backed up.
Yes, I don't think you can go after individuals. I mean, if you see somebody out in the street that's not wearing a mask and you tell them to put it on and they don't comply, I mean, what are you going to do? Run after them and ask them what their name is and try and give them a ticket? That's not going to happen. So I think concentrating on businesses and sports teams and other legalized gatherings is really the only way to go.
I respectfully disagree, Tom. I think that it really is about the individual and making sure that each person does that. You obviously want to have all the businesses and organizations also work to do that. And the order is for each individual to do it, and that's what the enforcement should be focused on, making sure every person does that.
I understand that. But how are you going to do it? You're going to chase after somebody?
No,
Well-
but for instance, if you walk up to a business, the police officer, and he sees a bunch of folks, hey, can you please put on a mask? I don't have one, here is one. You know, when somebody gets in his face and says, no, I'm not going to do it, the same with the health officer, then I think you can say, look, this is an important thing. If not, you realize that there are potential consequences and fines. And if it escalates, then that's certainly the next step that can happen. But I mean, obviously we want compliance, but that's really, you don't go looking for it. But I think also in the normal things, if you're doing an inspection, you tell folks, hey, look, wear a mask. That's part of the compliance and part of the enforcement. They're required to be done during those inspections and during their public service.
Yeah, and police, just having gone through my little police class that Acton was nice enough to send me to, can detain people for investigation. So they can say, hold on, stay right here, break out some ID. And you're required to do it. If you refuse, they can detain you until you provide ID. So hopefully it will never come to that. But yes, there is a way that you can get them to provide some ID and you can hand them a ticket. And I'm not suggesting that board members do that. I think it would even be awkward for members of the health department to do that. But certainly I think members of the municipal police or the state police could, that is something they're trained to do. Okay, well, other comments. Otherwise, I think might be a case where we stand by for news. I'll also make one other suggestion. The board has backed off from its cadence of weekly meetings. I'm just going to suggest this might be one situation where we may have to hold a meeting, say next week, just because if the state issues further guidance that requires action by the board to either empower the health department to do actions or empower agents or sanction businesses or whatever the case might be. It just, I guess I'm going to suggest it might be necessary to hold a meeting. So you're forewarned. And obviously we won't waste people's time if, that's not going to be necessary. So other members, Ms. Becerra, I see you've unmuted.
Yeah, no, I think meeting weekly makes sense. I'm going to assume that these order will be in place during Thanksgiving, and we may, just be prepared for some backlash from people who don't want to limit their gatherings at their private homes to 10 people. I guess we could just, share the importance of being socially distant and everything. But we just may hear something about that.
Yeah. You're absolutely right. I mean, I hadn't thought of that, but that's actually probably exactly why that order was put in place, was the upcoming Thanksgiving holiday. Well, thank you. Dr. Bill, I see you're saying something, but I can't hear you.
I'm sorry. The indoor gathering limit is maximum 25, not 10.
For private residents, I think it's different, Bill. Dr. Bill.
I stand corrected. You're right.
Yeah, that's for
It's
public.
maximum of 10. However, if you do it outdoors in this,
You can have 25. Yeah, if you want to have Thanksgiving outdoors, you can have 25 people. Yeah.
Bring your coats.
Yeah, hope for good weather. It also is a little bit, I don't know, it doesn't correlate to the size of the residence either. So some folks in this town have a residence that could easily accommodate 10 people and everyone could have their own space, and other folks that'd be a little more difficult. So, all right, well, if there's no further comments, it probably would be a good time to segue to a report from our director of the nursing service. Ms. York, if you would please bring us.
Hi, Bill. Thank you. It's nice to see everyone.
Thank
So
you.
the numbers in Acton right now, we are at 235 cumulative positives since March. There's 11 active cases in isolation. Just a few updates. I know at the last meeting we talked about, and there was a question by one of the board members regarding life care of Acton. I did speak with the executive director last week. They've been COVID-free since June, since they discharged their last patient when the original, from the beginning of the pandemic when they had issues. They're still doing testing for their staff. They still have to self-certify when they come in, but they're doing testing also. So they're in a good place, which is great to hear. The Inn Benchmark, the Inn at Robbinsbrook, I spoke with the executive director also over there last week. They have had one employee that did test positive, but in speaking with them, that employee had not been in the building in the 48 hours prior to testing positive. So there were no direct contacts within the building. So that was good news also. We did have a positive employee and 2 positive residents at a group home in Acton. That was about a week and a half to 2 weeks ago now. So that has been resolved as of actually yesterday. So there was quite a bit of contact tracing to do for that, but it has since ended the isolation for and the quarantine for the employees and the other residents. Follow up with the schools has been busy. Thank you to all the school nurses and the administration who are assisting with the contact tracing based on their seating charts, busing charts, attendance, all of those things. The school nurses have been fantastic with information, following up with families, speaking with me about different cases that have gone on with the kids and or teachers in the school, and really done a great job with reaching out to families. So that I'm very thankful for, since those can be a lot of calls. I definitely understand why the governor has changed some of the guidance. Since, like Cheryl said, in the last few weeks, it has been extremely crazy. Any positives that are coming through can be anywhere from 6 to 7 direct contacts to up to 30, is what we've been seeing in the last few weeks. So it's definitely concerning. We're placing more residents as on quarantine as a direct contact, not only from our tracing, but also from out of town positives who have been in touch with Acton residents who we hear from the other boards of health about, and we place on quarantine. So there's a lot of contact going on for that piece of it also. It's not just the isolated cases, it's also, making sure that the contacts are on quarantine and they understand the guidance, getting letters to folks to either go back to school or work or whatever the case is. So definitely has gotten busier, like Cheryl talked about. I know everyone's watching the numbers. Over the last 3 weeks, we've had anywhere from 6 to 7 positives in a 1 week period. So basically 1 a day, pretty much for the last 3 weeks. So it's definitely gotten busier with the numbers that we're seeing on the state, the state total numbers on a daily basis. I'm glad that Acton's still in the green. Cheryl and I talk about this all the time, and we actually were surprised we didn't go to yellow last week. I wouldn't be surprised if that changes, sooner than later, unfortunately. But it just seems like this is the next wave. I think that is pretty much for me for an update. Thank you.
Thank you very much, Heather. I have no questions, but members of the board, questions or comments on the nursing service director's report? Dr. Jacoby?
Yeah, when you do the contact tracing, have you had any resistance from identified contacts as far as following up on your suggestions?
The biggest issue that we see, and I know Cheryl has seen this also, is return of phone calls. When I call to identify someone as a contact case, there's multiple phone calls that go into effect sometimes as people aren't returning calls. If I have access to an email address, based on the lab entry, which that isn't often, but if there's any school contacts, there's usually an email address, so I try to reach out via email. But there are people that aren't returning calls or emails still, unfortunately.
Mr. Conaby, did you wish to?
I had a few questions. Thank you very much, Heather, for the update. You indicated that the number of contacts per case is increasing.
Yes, it's definitely higher than it was in the spring, and much higher than it was in the spring. It did go up through the summertime as people were out and about more, but now that people are indoors, I think, and the new rise is going on, there's definitely more contacts that people are having.
Yeah. That's what we unfortunately were thinking was going to happen. I guess, is there any other trends as far as demographics, younger, older, where they're being exposed?
No, unfortunately, it's a mixed case still, honestly, other than the trend of the hockey teams that we were seeing, which I'm personally glad that they shut the ice rinks down. That has been a huge challenge for us, even as the governor did put that order in effect, I think as of the 24th or the 23rd of the month. We found out about a week or so after that there was a positive case on a hockey team that we didn't know about. So definitely still was a challenge a week out after closing the rinks. But other than that, no other trends.
Okay. How about the CDC guidelines changing for close contact for the 15 minutes? Is that
Thank you. I was going to actually mention that and I didn't. I apologize. I have the website right up in front of me too. So the CDC did change the guidance on direct contacts to be a cumulative total of 15 minutes or more over a 24-hour period. So we're, explaining that change to folks as we're doing our contact tracing now, since that has changed.
You mentioned having the email is very helpful along with the phone number. I'm thinking, Cheryl, as you're getting some of the group gatherings, maybe requesting that from the different folks, so it's easier for her to do contact tracing in the event that it would be necessary. So ask groups to have phone and email to try to get ahead of it a little bit. Speaking of get ahead of it a little bit, any more information about the flu clinics?
So our drive-through flu clinic is this Saturday from 9 to 1 at the DPW department. It's posted on the town website. A news flash went out. It's on the signs within town. There is a PDF up on the town website and on our website, the ActonNursingServices.com, that has the paperwork for you to fill out prior to coming. We're asking people to take a copy of their insurance card and bring that with them to limit the exchange of insurance cards and pens and things like that. So we're asking people to fill that out ahead of time. Cheryl and a couple of her team members are helping out, which we're thankful for. Acton Police will also have a couple of officers to assist with any traffic issues that we could potentially have.
Two questions to follow up to that. One is this going to be just the regular vaccine or the senior high dose?
So this is only the regular. We don't have enough high dose to have it at that location. It's very limited. We did 2 senior clinics. We are opening up another clinic to use the last of it at 30 Sudbury, where we did the first 2 about a week and a half ago. So we'll offer that last small amount that we have at a senior flu clinic. That was inside at 30 Sudbury with the doors open. Only two stations in that huge dining room. So plenty of space for people to socially distance at the time. And of course, wear masks.
Right. And I think the last thing is, I mean, obviously folks who missed that, they can go to their primary care physicians.
Right. Yep. They can go to their primary care. There's also a lot of pharmacies that have flu vaccine. I just wanted to note too that at Saturday's drive-through clinic, it's only for 9 and above. The reason we did this is because typically the younger ages, it's difficult to give them a vaccine without mom or dad holding on to them or having them on their lap sometimes. And we really can't have mom or dad getting out of the car. We can't have, a nurse hanging in that car trying to give a vaccine and being close to a child or another family member for an extended amount of time because we're just trying to keep everybody safe, including the staff that's doing the clinic.
Yeah, it's pretty tough. I remember those days.
I do too, unfortunately. Well, actually, I live that every year at flu clinics.
True. Just pointing out that there is vaccine available if people can't make the Saturday at Acton Pharmacy, CVS.
Yeah.
Locally.
Yeah, there is. And I know there's always a concern about for folks that can't or don't have transportation. There's enough pharmacies in Acton between Acton Pharmacy, the 2 CVS locations, which I believe both are giving out vaccine, as well as Walgreens at Powder Mill. So there's enough locations that if people did need to, walk to one of those locations, if they live close enough, that's great. And then, of course, the van in town is still doing some of the transportation to those locations, the pharmacies, most especially.
Thank you.
Thank you.
Okay, thank you. Any other comments or questions from members of the board? Then, Cheryl, can I ask, are there any comments or questions from members of the public for either your report or the nursing service? You're on
Yeah,
mute.
muted. Yeah. No, I don't see any comments.
All right, very good. Then I believe that that brings us then to our first regular agenda item, which is a plumbing code variance for the NARA Park restroom.
Correct. So I believe we do have an audience member to talk about this, but this is for the new, there's 2 new buildings up in close proximity to the Miracle Field. In this bathroom, they're requesting that they put 2 toilets in one room without a divider, and it would need Board of Health variance from the plumbing code to allow them to do that. And they can speak to the rationale, but basically it's so a caregiver can assist. And then there's 2 different, I guess 2 different heights of toilets for whatever need may be needed. So they'd like to put the 2 toilets in one room, but it would only be utilized by the person assisting, a person that needs some assistance. So, for the most part, there'd be 2 people in there, but with 1 people using the facility at a time. So I can take a look to see who's here. If whoever would like to talk about this could raise their hand. So Andy Richard, I'm sorry, I could be saying your name wrong. If you don't mind, I'd like to allow him to talk.
Yes, that's fine.
Okay. Should be all set, Andy.
Okay, great. Can you hear me?
We can hear you.
Excellent. So thank you very much. Yes, just to give a quick overview, the building itself has a men's room, women's room, and this family room in the middle. And the intent with this family room was to, just like the Miracle Field, to reduce barriers to families who are using the facility, the overall park as well. So we wanted to keep as much space available, but we also wanted to accommodate individuals of different sizes, which is why we have the 2 different toilets. The intent is that this room is only used by an individual and a caregiver at a time. It has a lock on the door so that it's just those 2 in the room at one time. So you would never have 2 people sitting side by side on these 2 toilets. And there's also within the room, there's a lift table to assist. The goal really was to go above and beyond what public facilities have for those with disabilities and those who have a caregiver who accompanies them into the room and assists. So that was the intent of the 2 toilets side by side. We didn't put a barrier there because, again, we wanted to allow as much free space to move between, to use the facility without a barrier to impede it. Does that make sense?
Yes, I understand what you're saying, and I did actually read the accompanying information. I guess from a health perspective, I don't have any particular comments. Do other members of the board have questions or comments? Mr. Conaby.
It seems like a very prudent thing to try to do to allow maximum mobility within the facility. I guess the only thing, is this already been constructed? Or is it planning at this stage, Cheryl?
No, it's in the process of being open to the public.
Okay, so it's physically already been constructed, but it hasn't been turned over to the public because you need the variance, is that correct?
I believe that's the case, yeah.
Yeah, I think as long as that it meets the other requirements and that it be labeled a family handicap restroom with single occupancy, it seems like it meets the intent of what we're trying to do is in its sanitary facility, so it's appropriate for health.
Thank you, Mr. Conaby. Other questions or comments from members of the board? So I believe this one does actually require a recorded board vote. So if anyone would wish to make a motion to grant the variance to the plumbing code, Mr. Conaby, I see you're unmuted.
Yeah, sure. As I made the comment, I'd be happy to make the motion to recommend approval of the variance with the conditions that it meets all of the requirements and that it be a single occupancy unit.
Can I just ask a procedural question, Cheryl? I believe this is a local upgrade. Is that correct? In other words, it's not a recommendation, it's the actual variance, or is it a recommendation to the state plumbing board? You're on mute, Cheryl.
I'm pretty sure it's a recommendation to the state plumbing board, but
Okay.
they needed our approval before they could go there.
Great. Okay, then Mr. Conaby's motion is perfect. Is there a second?
Yeah, I'll
I'll
second it.
second it. Oh.
Well, we have second and thirds. Dr. Bill, I think you were half a second ahead of Joanne. So we have a motion made and seconded. I'll ask, is there any further discussion by members of the board? Cheryl, any questions or comments from members of the public?
I don't think so.
Very good. In that case, all those in favor, please say aye.
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 I think I heard everyone, but are there any nays? I also vote aye. In that case, motion carries unanimously. Thank you.
Thank you very much.
Have a good night.
Thanks.
That brings us to our next agenda item, which is a special permit for, it looks like, I think it's one site on Great Road, but with multiple addresses.
That's correct. It's 126 to 128 and 132 Great Road. It is an existing retail / office space. It's in Aquifer Zone 3. It's approximately 2,400 square feet facility. They've proposed nitrogen reduction. And there are a couple of variances that you might have noted on the plan. But those variances, the board's given approval for my department to grant those as long as they add the nitrogen reduction. So I didn't bring those variance requests before you tonight. but it would be Article 16-6.2.7 if you wanted to grant that variance as well. But they are looking for an aquifer special permit for that area. I mimicked conditions that we've done on the last couple aquifer special permits, and I can bring those conditions up, I think, if you'd like to see them on the screen. So let me take a look.
So I'm on mute this time. That would be great to bring the conditions up. And I just had a general question. What is the site use? I mean, what's going to occur on this site?
Currently, it was a vape store and landscaping. I don't think that I think they're existing businesses. I don't know. I thought the engineer was joining us tonight, but I don't see him.
So if it's an existing facility, why do they need this permit? That's what I'm kind of getting confused about.
So we've brought special permits before the board, for aquifer special permits for the board when it was commercial. So we brought it before you because of the commercial aspect of this. Sorry, I'm trying to find the.
No worries. Maybe what I'm not understanding, Cheryl, are they building a new building, or are they clearing land, or what's changing?
Oh, they're repairing their septic system.
Oh, okay.
Sorry.
Got it. All right. Now I understand.
Yeah, I should have said that. It's just a repair. I don't know. I can't seem to share it tonight.
You just did.
No, but this is the plan. I was looking for the conditions. So, I mean, you can see here. Oh, yeah, actually, you know what? I think it does say the names of the what's currently here. Yeah, Daily Vapor and an appliance store. And then the 132 is a different plan, but that's the building to the right. And that is just like a couple retail and offices. So hold on, let me see if I can do this. I'm having a hard time today, sorry. Let's see.
Well, Dr. Bill, you look like primed to make a comment. Would you, if you'd like, you could go ahead at the same time. Cheryl is pretty good at multitasking.
As they say in murder mysteries, no comment.
Okay. Mr. Conaby.
Yes. Obviously, since it's a repair, it seems appropriate, but this is a little different than the last two permits we had where they were pretty much a defined use. I would suggest that as part of the aquifer protection, you have no increase in design flow or change in use without the departmental approval as part of the conditions of the aquifer permit.
Seems reasonable.
Yeah. It obviously wouldn't have been appropriate for the fire station, which I think was going to be, or the school, which tend to have a long life. But I think for this type of one, we are rebuilding it, it would, in the zone that it is, be an appropriate additional condition to add.
If it's not there already.
Oh, finally.
I didn't see it.
No, I did not put that there. I can add that.
Well, comments or questions from members of the board? Not seeing any. How do members feel? Does this seem like a reasonable thing to do with the conditions plus the additional one?
So if I understand correctly, the building uses haven't changed. It's repairing a failed system.
Correct. And the design is equal to what they currently have out there.
Cheryl, it's Mike, I just had one question. You mentioned repairs to the system. Is this a failing system at this point, at where we are now?
I'm not sure if they actually got a Title V report that it's failed, or if they just felt that it was, they were experiencing issues and they went ahead and decided to replace it. It is a very older system there, so I would not be surprised if it was failing. We haven't noticed any problems with the system, but again, I think they're just taking the initiative to repair it before things happen.
And it would seem that the repair is going to be an improvement over what's there now, right? Because what's there now does not include nitrogen reduction.
Correct.
Well, so are members inclined to allow this variance?
I think I would, Bill, but just one clarifying comment. You mentioned you weren't sure why this would need to come to the board, but I think Cheryl answered your question. But just if you can clarify for me why you didn't think it necessarily needed to come to the board.
Oh, no, that was a little bit of a circular question on my part, Mike. I just wanted to understand what the issue that the board needed to decide was. That's when Cheryl explained what it is, I was thinking perhaps it was either new construction or it was a change of use or something along those lines, like they were going to be adding buildings to the site, or they were going to, you know, be putting a retail, well, it already is retail. They were going to be putting residences there or something along those lines. That's I just wanted to understand what the parameter was. When she explained it, then I totally get it. Yes, we always want commercial special use permits for board consideration.
Okay. Thank you, Bill.
See, Bill,
You're welcome, Mike.
I'll make a motion that we accept the variance.
Very good. Thank you. Is there a second?
I'll second it.
Thank you, Joanne. Ms. Becerra. We have a motion made and seconded. Is there further discussion by members of the board? Mr. Conaby, I see you have unmuted. Did you wish to make a comment? Or
I
are
was
you
just
just
getting ready, but I was also just going to clarify that it was with the additional condition about no increase in flow or change in use for the motion.
yes?
Okay,
Yes.
thank you.
Okay, well, and since you're primed to vote, I will say all those members in favor, please say aye.
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 Thank you. Any nays? Hearing none, I also vote aye. Motion carries unanimously. Well, thank you. That now brings us to some proposed changes to Articles 11 and 16 for just board awareness and discussion. Cheryl, would you mind filling us in?
Yeah, so hopefully I don't have a problem pulling this up as I did with the other one. But so we, I see I have Article 16 here, but we have been issuing, you know, we've been following some, actually, let me step back. So we're proposing these changes to the regs to help us do our job more effectively and to you know, further define things that we've had some issue, not issues, but some questions about. So sometimes people say, what is what's you know, what does an SAS mean, right? So I'm trying to find, sorry, I'm trying to find Article 11 here to show you the changes that we are looking to do. But I don't know why I'm having such a hard time today. Sorry. All right, here we go.
It's Monday.
It's Monday. It's been a long week. Now, can you see that or no? Am I not screen sharing?
Not yet.
All right. Wow. How about that?
Nope.
No? Oh, I'm having such a hard time today. Sorry.
Oh, something's happening.
Well, that's my screen, so hopefully now we can get this up. How about
Oh,
that?
is that your boat? Okay,
No.
I'm impressed.
No, can you see the Article 11 now or no?
Yes.
All right, good. All right, sorry. So the first part we proposing to change here is what I just talked about, where we're definitely, you know, just trying to clarify here because we do have a lot of people question. So it's just basic, you know, we're just trying to be more simplified here. So instead of saying sewage disposal system, actually listing out the components. Same with the next article. And then this was an add-on, and I apologize, this should have been 6.1.5. So again, a clarification where water and sewer lines intersects, at least one portion of the line shall be sleeved to the extent that no portion of either line is closer than 10 feet to each other without a sleeve in between them. And then, so this one, we have quite a few, currently, we have quite a few septic systems that are replaced, and they're replaced, and as long as Title V indicates it, as long as a old tank can pass a Title V inspection, you can retain it. So we're getting a lot of feedback from buyers who think that they have a brand new complete septic, and they're finding out that their tank is, you know, 50 years old. So we're proposing that we allow only 1,500 gallon tanks to be utilized and to pass Title V. We've been kind of by policy requiring any new tanks to be dual compartment and monolithic. So we've proposed those as well. And then,
Cheryl, can we go back to that?
yeah, sure.
You said tanks with less than 1,500 gallon capacity must be replaced. So we've had some folks that have had 1,000-gallon tanks and they've put in a second tank with 500 gallons and a pump chamber after that, or two tanks in series. By this, you're saying that they would have to yank out the old 1,000-gallon tank and put in new 1,500-gallon tanks. They wouldn't be able to keep the existing and just add a second tank. Is that correct?
No, I think the intent of this was for, you know, the person that has 1,000-gallon tank and they want to just retain the 1,000-gallon tank and they don't have a need for a pump chamber or don't put another tank in series, because if that 1,000-gallon or even that 750-gallon tank passes Title V, it can be allowed to be retained.
Yeah. Maybe we
And
should
then
just,
the
yeah,
rest.
when I read it, it says tanks with less than 1,500 gallons must be replaced. Why don't we just put must be upgraded? Because then, you know, if a tank is solid, it wouldn't have to be taken away and put a whole new one in. It could just,
Okay.
I'm just wondering if that's, it seems particularly if you have a case of a tank that's relatively new, that doesn't make
No,
sense, but it has to be
upgraded's a
obviously
great,
compliant.
yeah, upgraded's a way better word, so thank you for that.
Okay.
So now, Mark, I'm confused. Does that mean you can add a 500-gallon tank after it and then that's good, or you can just leave the 1,000-gallon tank and it's good?
Neither. I think what Cheryl is saying is that you're going to require 1,500-gallon tanks, but if their existing system has less than 1,500 gallons, it would have to be upgraded to at least 1,500 gallons when they replace the system. So therefore, we've seen cases where they could take the existing 1,000-gallon tank, which would not meet that requirement. They could put a second tank in series. So now they could put two 1,000-gallon tanks or a 1,000-gallon tank. We've seen folks that have taken a 1,000-gallon, then a second tank, which is 500 gallons, instead of compartmentalizing it, and then putting a pump chamber. So it really becomes 3 chambers in series is the best way to describe it, or 2 chambers in series. But that would I think what the goal she's saying is to increase the volume and retention to a minimum of 1,500 gallons for new systems going forward.
Okay, so I'm sorry, and maybe you already answered this. So adding a 500-gallon tank would meet that requirement if you have 1,000 gallon.
But the reality is you don't buy a 500-gallon tank. The next size is 1,000 gallon. It's commercially available.
Right, unless they needed a pump chamber, then they might be able to flip it around, get a 500 compartment, and then, you know, a 1,000 compartment for the pump chamber. So, it depends, but yeah, this has been a pushback that we've gotten from, quite a few buyers. So, it was just something that we thought we should discuss with you guys to see if you're inclined to make these changes.
Yeah, it does seem a good idea to go to 1,500 gallons in the future.
Yeah, I mean, I happen to, there are many neighborhoods in Acton that are populated with 1,000-gallon tanks. That was kind of, I think, the standard for quite a while. And so I'm just trying to understand what the impact would be.
Good point, Bill. I mean, there were a lot of folks that had 3-bedroom systems were pre-Title V of the early 90s would have 1,000-gallon tanks. I mean, and in that case, when they upgrade, they would have to go to a 1,500-gallon, new 1,500-gallon tank or add a second tank to get that minimum tankage for compliance in the future. Does that solve your problem, Cheryl?
Yeah, that's exactly
Okay.
what we're looking for.
And I guess you could make it unless approved by the Board of Health or its agent for that section as well. But that kind of like is requesting a variance. So I don't know whether you want to do that, but there may be some cases where the lots are so constrained that it may not be prudent to do so, or it's too close to the foundation. I can think of lots of situations we've seen where a little bit of provision for an opportunity for a variance for specific hardships might be appropriate.
Yeah, and I was just trying to think, I mean, we can discuss this further. I understand the concept, but I know in the past we've looked at the benefit of removing a tank and replacing it as carrying its own set of risks, right? Because the tank can settle at a level or, otherwise leak. Whereas if you have a structurally sound tank that's working, then there's a benefit to leaving it alone. So, well, anyway, in terms of what we're doing tonight, is opening the discussion. It's fine. We might need to figure out exactly how we'd implement it because, we also, this would only be triggered. I think what you're saying is when they're replacing the system. So if the 1,000-gallon tank system passes Title V, then no action, no change is necessary. Is that?
That's correct.
Okay. Okay, and then how would the monolithic tanks jive with adding a second tank? Would that, the way I read this is the 1,500 gallons had to be a single tank, but that would not be the case?
I don't understand your question, sorry.
So 11.7.8 says it
Yeah.
has to be monolithic tanks.
Yeah.
Actually, a little bit of it's covered by something else on my screen, but you can't do a monolithic 1,500-gallon tank if you add something to a 1,000-gallon tank. That's what I was.
All right, so if you're retaining the 1,000-gallon tank and then you just need additional, you're saying no, you wouldn't have a monolithic for the current one, but for the new ones.
Yes.
Yeah, I see what you're saying. For the most part, we can change the wording of this to reflect that, if you'd like. For the most part, there's I would say probably 50-50 of people having to put a new tank in and not. And then, I think the purpose of this was just to require it for new tank installs.
I can see a problem already. Look at the new school project. Those aren't monolithic. Those are pieced together. So I guess.
Well, monolithic is, I don't think they could have got a monolithic with the size tanks that they got.
Right.
So you're right. So we need to reword that.
That's all I was getting at. So I think maybe just all new tank and pump chambers shall be as approved by the department. So you cover it, but I think Bill makes a good point. And some of them also come in two pieces, so they're not monolithic. They're two segmented that are put together, depending on the size and the other issues.
Yeah, good point. So going down here, so we had this at the last meeting, so we're proposing that any open bottom chambers with an invert height of less than 4 inches shall be set on the a geogrid or equivalent. This is what we talked about at the last meeting where we had the settling of those chambers.
Did that get resolved, by the way? That was supposed to have been,
The plan, we told them that they had to get the plan to us by October 28th, which they did. We're just waiting for the installer to do the work. So I think how we worded it was get us a plan in place by the 28th, and then we were going to give them 30 days to get the install done.
correct. Okay,
Yeah.
so there hasn't been any update other
Not
than the
yet.
plan was received on time.
Correct.
Great.
Getting back, you have equivalent, maybe you just ought to put equivalent as approved by the Board of Health or its agent, just same language as you have up above for the tanks, et cetera.
Okay. Thank you.
Yep.
I think that's it for this one. Oh, no, sorry. So on Title V inspections, you wouldn't believe the amount of people that the answer to, do you have a garbage grinder, in that Title V inspection is yes. So we find ourselves chasing people to have those removed. You know, so a buyer doesn't buy the property, no, you know, with a garbage grinder in it, and that they're aware that there's garbage grinders aren't allowed unless you have a system size for one. So this is for clarification. So it's in a regulation now. So rather than just, you know, Title V. So this was for more clarification. The next one, the water softeners. You know, this should already have been in there. And then we're asking for, so when someone takes a look at what the high groundwater is for a Title V, you know, sometimes they're looking back at records from the 70s or the 80s. So we're just requesting that they look at anything that's 1995 when Title V changed or after.
And why is that? Do we think the data is unreliable?
Well,
Before
back in
1995?
the 70s and 80s and before 1995, we used to look in the hole and be like, nope, no water. You know, we never looked at modeling or redoxymorphic features that they call it now. So we look at water or where water once was a lot differently today than we did back then.
Okay, so the data is unreliable.
Correct.
Yeah, okay. Got it.
And I
I have a
think
question. Wait.
that's
Sorry.
it. Yeah.
On 11-13.7, you mentioned water softeners. Would that also include things like reverse osmosis and filters that people are putting on their systems now because they're concerned about PFAS and arsenic and everything? I've been hearing, you know, anecdotally that people are doing that, and I know that that could be problematic. So I'm wondering if you should further, you know, water softeners or filters, or if filters are addressed somewhere else.
No, I would agree with you, Joanne. It should be added there. But yeah, that was, you know, I think we did these changes prior to that becoming an issue. So yeah, we should definitely talk about RO systems in here as well.
Quick question, Cheryl. I mean, if you have, unless you have RO reject, if it's just a membrane or a filter, I don't see how that is adding anything to the septic system. It's covered by the plumbing code for the installation, service, and maintenance, but I'm not so sure that a filter, whether it be an RO filter or a carbon filter or a regular sediment filter, would be an issue going to the septic system. It wouldn't be introducing anything. Now, if it was an RO system where where you have a reject, then it certainly would be an appropriate condition, because obviously that shouldn't be going to septic. That should be going to storm or sanitary plumbing code. But I'm not sure that a filter is really appropriate for dealing with this. And indeed, we want to have some filters like effluent filters. So I think we need to kind of think that over a little more.
Right.
Yeah, and I'll just point out, because I have memory that the prohibition on water filters, whole house water filters, was actually a water district requirement. That they were concerned that it was a medium to grow bacteria, but they now have non media that doesn't grow bacteria, and I believe the water district has removed their restriction. Matter of fact, I know they've removed their restriction on water filters. So we should probably coordinate with them. I mean, I don't think the Board of Health ever was concerned about water filters per se. It's just, as Mark says, it's so that you're not discharging, concentrated reject into the septic system and then, causing problems.
Yeah, I mean, it's increasing the flow, because to get the water which has been treated from the RO, that concentrate versus the other stream, 25%. So you're using more water, which is trying to avoid going to the septic system. But I think we need to be clear, because there's like 80% of the folks in Acton that are on municipal water, but there's still a number of folks that are on well water. And some of those may very well need to have sediment filters and other things. And I think we got to be a little cautious in how we do these things. I mean, some of the water softeners, I mean, unless it's a backwash or some other things, you're really not generating an awful lot. But I think we got to be careful how we word this, because there are other provisions and other consequences to it.
We can change, we can take a look at this a little further and change that wording.
Okay. Is that it for this one?
That's it for this one. So hopefully it doesn't take me as long to pull up the other article. Here we go. That was easy. All right, so this one, there's only a couple changes or proposed changes. And I see we duplicated ourselves here, I think. So let me just get down to it. So, I see, Evan took a stab at these and looked at it, but I do see that 16.6.1 does talk about will not exceed 1,000 gallons per day. But Evan was thinking, and we were chatting about this, that the permits could potentially be issued by myself if there's a flow of less than 1,000 gallons per day. So I don't know how you feel about that, but both of these changes do talk to that. We're just adding in these with a flow of less than 1,000 gallons per day. I think that's it. Yeah, that's it for just these two minor changes. I don't know. I'd like to have board discussion on this as well.
Well, how do members feel about it now? So a typical 4-bedroom house is 440 gallons per day, correct?
Correct.
So and I guess maybe this is the part I'm struggling with. Don't you already, you don't bring standard installation or repair plans for board review? So are you saying that, in other words, the variance to Article 16 could be granted by the health director for systems less than 1,000 gallons a day?
No, I thought the idea of this was for the Aquifer special permits.
Oh, okay.
So, bring them down to our level for anything under 1,000 gallons per day. That's what I thought the intent was of this change that Evan and I discussed.
Okay. Without seeing the structure, it's I'm sorry, I got a little lost. That on what you just said, though, seems reasonable to me. I don't know how other members feel. Any other member have comments? Apparently, Mr. Conaby.
It seems reasonable on the lower ones. I'm not sure if 1,000 gallons is the magic number. I mean, obviously, duplex was like 660. But, something along that line. I was also thinking going back where we had some questions about, the hydro studies and treatment plants and things. I think we might be wanting to have the nitrate loading studies for anything over, if we're going to use 1,000 gallons for the basis for the apartment, more than 1,000 for the nitrate loading, and then treatment plants maybe go to 5,000. So we're kind of more inclined with the package treatment plant regulations.
What did you say for the number for the nitrate loading, Mark?
I was thinking 1,000 rather than 2,000. But I mean, I think the point is where it's, in the aquifer protection zones. I mean, I think that may be something we want to consider. Because I mean, obviously we've got some issues with the groundwater quality, and I think we're going to be using more caution going forward and trying to protect some of our resources in town, considering what we've got some issues right now. So,
It's
just
fine by me.
yeah, but I'm thinking you just back those numbers down so there's a little bit more oversight on those, and we probably are going to see some. Well, whatever the number is tends to be right where we see a lot of the requests and the permitting. We've seen a lot of developments at just around 5,000 gallons a day with treatment plants. So I think we probably ought to require them for more than 5,000 and do the hydro studies there as well. But the nitrate, I think with the plan, we could probably go 1,000 gallons, but I'm open to discuss, just opening the discussion of what you folks would like to do.
Okay. I don't know. Haven't haven't given it a lot of thought. I'm not sure if other members have either. I mean, what I'd suggest is for both of these, if you wouldn't mind accepting the comments and then making another spin for a future meeting for us to take another look and maybe some in line with what Mark's was thinking, some proposed changes if there's going to be like I see 4.2.4 if we're going to change from 2 to 1, that could be put in as a proposal.
Sure, we can take care of the changes that we discussed tonight and then bring it back for future discussion.
Okay. Well, I ask if there are other members have questions or comments. Mr. Conaby.
Yeah, I guess I was going to go back to 16.4-2-5. It says the monitoring wells downgraded required for any capacity greater than 550. I was thinking that, as we are backing things down, but I mean, obviously a 5-bedroom house, we have commercial or industrial use. Maybe we should just say non-residential use. But what I'm wondering is, do we want to have monitoring wells if we have a duplex with 660 gallons? That seems a little bit onerous in some cases. So I'm wondering if we want to look at that as we're seeing more issues with some of the comments. I mean, just another thought of where we're looking at the numbers.
Okay. So you're suggesting that we should actually increase that number.
I'm just wondering if, where you might have a 5-bedroom or a 6-bedroom residential dwelling. So maybe 660 would be the number that we use. And then maybe the same thing goes with the permits for the department.
Okay. Those are reasonable suggestions.
Okay.
All right. Well, any comments from members of the public, Cheryl?
We don't have any public.
Okay. Well, in that case, that brings us to the minutes of October 19. And I'll just start out by saying I read them. I have no comments. They look fine to me. Any members have comments on the minutes?
I reviewed them and did not have any comments.
All right. Align with Dr. Bill, no comment.
Mm-mm.
So would someone care to then, since we have no comments, then accept the minutes?
I'd make a motion to approve the minutes as written.
Thank you, Mike. Ms. Becerra, are you going to second it?
I am.
Excellent.
Second.
Thank you. A motion made and seconded to accept the minutes. Is there further comment? Any comments from our non-existent public? Very good. All those in favor, please say aye.
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 Any nays? Minutes are accepted. Thank you. So that brings us to the end of tonight's agenda. Thank you all again. As obviously, the governor's order pointed out, here we go again. Hopefully we will be able to tackle this next surge, perhaps even, with more tools than we had for the first surge. But along those lines, Shaw, could I just ask you, would you please post a meeting for next Monday? And that way, if we need it, it's already posted. And if we don't need it, we'll just cancel it.
Okay.
And I'll just say my intent would be to hopefully cancel it, but I'm just concerned that their developments are moving quicker now, and it might be necessary that that the board needs to meet to address some issues. So, but with that, I just would like to thank everyone again for your participation and ask if there's no other business for tonight. We could probably adjourn.
So moved.
Thank you,
Second.
Joanne.
And second, if Bill hasn't already.
All right. All those in favor of adjournment, please say aye.
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 And any nays, the motion carries. We are stand adjourned. Thank you all again. And hopefully it'll be 2 weeks before we meet again, but potentially 1 week. So have a good night, everyone. And
Good night.
Thank you.
Aye.
bye.